Hi guys, hope you're okay. This is Daniel. So this video is just talking about the post psychological impact of COVID and how other people interact with you maybe when you've had a positive diagnosis. Because for me, when I came back home, I was quarantining for I think it was 14 days. During that time, for those of you who don't know, I live with my mother and sister at the moment, so it's a convenient situation in some senses, money, but then in other senses, obviously, you're having to deal with other people and the fact that they are also part of the home that you live in, so you've got to be very cooperative. Um, and what was interesting is that because it was just me and my sister for a brief period, it was difficult because she was actually quite reluctant to want to be around me. And in some ways, I can understand where she's coming from because essentially, I've, as far as she's concerned, been carted off to hospital. Um, and then I've come back, and then she might be feeling quite vulnerable and might get sick. Um, because she hasn't had the vaccine, neither of us have. I think that was something that was playing on her mind a little bit as well. The fact that I might still be asymptomatic and I might pass something on to her, but I had to kind of reassure her and say that the NHS, National Health Service, wouldn't let me leave the hospital if I was still a hazard to society. And I think that it's not just necessarily with her that I've had these types of conversations and interactions because my own family have, been very cautious with me, and rightly so. I wouldn't expect them to be any other way. But it's very difficult when you are in a hospital bed and then the hospital staff are trying to get rid of you and they say, is anyone able to pick you up? And then there's lots of people who say no, they can't because, they're trying to protect their own health. And, it's not necessarily saying there's a stigma against people who've been sick, but I am quite a candid person generally, so I'll speak quite openly about this to people who are interested, and in some cases to people who aren't interested as well. For example, when I'm at the gym, I might be in the steam and sauna, and I might be talking about this experience and explaining from the start what happened. And you can see that some people are very respectful, and some people, might walk up and walk away. And there was a guy who actually walked up and walked away. But then afterwards, when I was on the sun lounger just relaxing, he came over and spoke to me, and he said that he felt I was quite brave for speaking quite openly about this because he had actually had a positive COVID diagnosis himself and was admitted to hospital for, I think, a very long time, like a series of months. So he had it quite bad, but then he was explaining that his experience after COVID has been quite similar to my own in the sense that a lot of people don't really want to engage face to face, and anyone who comes to visit this particular guy at his house, they've been coming to the end of the gate, so they don't come into his house. And in some ways, I can completely get that because if people are fearful of their lives and think that they might have a terrible time with it, then it's likely that you wouldn't want to really expose yourself necessarily. So, with that, I just think that there's a lot to be really discussed, and I think that the way that we can overcome, the potential stigma of what actually happens next is by having these really frank, candid conversations with our loved ones because, there is a lot of information out there, and I think that it can be conflicting. And when that happens, it just causes a lot of confusion and it can cause disharmony in the home as well. And it's just something I wasn't quite expecting. And I don't think you can prepare for it, but the reason I'm making this video is just to express this point because I don't know whether there are lots of conversations about this, and in some ways, it's really tricky to gauge because you are essentially free to roam around after you've left your quarantine, but then what do you do after that point? Do you still wear a mask? Do you still adhere to social distancing? And it's weird because you've also got these antibodies, so you know that you've technically been immunized in a way because you've gone through the process of actually getting over the actual disease or virus, whatever you want to call it. Um, but then in some ways, you can feel like a bit of a social leper because there are family members who are saying, don't come around me for a while. And I don't know, it was just an interesting observation that I'd seen. Um, And I haven't really gone into the extremes as to what happened with me and my sister, but just to give you some context, she was very vocal about the fact that COVID had come into the house, and it almost felt like I was being blamed for contracting it. Whereas, I'm just living my life really. In terms of when I actually picked it up, I don't even know where I was. I'd been to the dentist that week, I'd been to the gym twice, and before that, I'd just been to work as normal. So there was nothing out of the ordinary. I wasn't engaging in congregating at parties or going out clubbing. So, you just can't control these things. And I think that the biggest takeaway is that we can't hide from life. And if you are walking around in a state of fear and you're just wondering when you might be struck by something that you can't see, that is going to have a massive impact on people's psychology and mental health. But I would say for my own mental health, as soon as my quarantine period ended, I knew I had to leave the house and I knew I had to get to the gym, because for me, that is the way that I actually create normality in my life and create some form of routine. And I think it's very easy to fall back into an old mindset where you start to almost become a bit of a victim of your own circumstance and start to wallow in the thing that happened to you. There's a lot of people who I speak to on a daily basis who keeps talking to me about how terrible of an ordeal this was, and I'm like, well, it was an ordeal, but at the same time, I didn't die. I'm still alive. I'm still here. So for me, I think you have to have a really strong set of resilience and a bit of fortitude just to be able to say, I went through something. It wasn't ideal, but I'm glad it happened. For me personally, I'm really glad it did happen. I think it was essential. I think it was a case of when, not if. And yeah, I got a very severe case of it, but I lived to tell the tale. So that's my partial optimistic outlook on this whole situation. So if you've got any further thoughts about this, I'd love to hear from you. Have you gone through COVID yourself? Did you have situations where family were a bit weird with you? Friends, maybe? Did that subside? Has it still gone on? Yeah, any thoughts and feedback are always welcome. And I hope you're all well. Take care. Speak soon. Bye.